Hey, just getting online because I had another interesting interaction with some people that I used to know back in California. That I still know, but who are still living in California. So, to give you some brief background, I used to work as an STD counselor in Northern California. And I did that for years as a part-time job to supplement my income, my full-time job. And after a while, I became known amongst my friends as the person to go to for information about STDs, which was really hilarious considering that, out of all of my friends, I was the most chaste of the group. But I had all of this information about, the latest medications and the latest diseases, infections, all that stuff. So, one lady in particular that I became friends with called me up. And give you a little bit of background. I became friends with her through the STD counseling session. She was in there because she had some risky behavior a few nights in a row and she was terrified. And the first time she came, I told her, you're going to have to wait at least 30 days. Back then, we were telling people wait 30 days to get tested. She came back in 30 days and then tested. Test came back fine. I told her to come back in another 60 days, and she did. And said come back in 6 months, and she did, and she was fine. So after all that interaction and talking, we kept in contact with each other. Well, when I moved out here to Atlanta, I lost contact with a lot of people that I used to be really close friends with. And that's all on me for being too busy. She found me on Facebook, and which is really interesting because I'm not in Facebook under my name, but she found me anyway, found my face. She said, "Oh, can you with those fat face, those fat cheeks?" And called me up. You know how there's some people you can just start talking to, and it's if all the years never passed. Like it's as if I just spoke to you last night. That's how it was. We just jumped right back into conversations. We caught up with family members and jobs, all of these things. Then she got to the good stuff. She said, "I need your help." She said she's dating a man that has asked her to marry him, and he just informed her that he was HIV positive. So my first question was, "Had you all been intimate at all?" And she said they had been intimate with condoms. I'm like, "No, did he tell you? Like, did he just tell you now? Like, how long have you all been intimate?" So they had been, having sex with each other for about 9 months, dating for 2 years, having sex for 9 months, every time with a condom. And I said, "Did you all have sex? I'm sorry, did you use a condom for oral sex?" And she said no. And I became pretty angry at that point. I'm like, I'm aware that California has this law that people do not have to disclose that they're HIV positive, but that's recent. That just happened this year, the last couple of months. But he should have told you what his status was. He should have told you, and you definitely shouldn't have been putting your bare mouth on his raw penis without some protection. And he should. I was just. So I already don't even like him. I just don't like him because I think he put her life in danger. So she told me that she was a little bit afraid and that she um, wanted to know if there were any tests that she could take to find out right away what her status was. And I said the only test you could take that would give you more immediate results than the normal quick swab or the blood test would be this test called I think it's called RNA. Excuse me, I'm choking for some reason. It's an RNA test, and it tests for the antibodies. This is the only test that tests for the antibodies within 7 days of exposure. And I should know that. I can't remember. But you can get it in any lab. Your doctor's office has it. They probably won't give it to you, but you can go to any random lab and just ask for this test. and you have to be free of sexual activity of any kind for 7 days. I suggest going on the eighth day, getting tested. Results come back in 2 days. And they normally give you your results in person, whether or not they're negative or positive. So I could tell that she was concerned. She was trying not to seem concerned, but she was. But and I got into some pretty explicit details with her. Like I went from friend mode into STD counselor mode. I said, so did he ejaculate in your mouth? And she said yes. I said, okay. Do you have any cuts in your gums or any teeth that are broken? She said, yeah, I got a couple of broken teeth. I have a cavity over here, a raw spot over here on this gum, and I didn't want to concern her because the common information that we communicate to people is that it's a very low instance of getting infection or transmitting HIV through oral sex, but it's possible because if you have any cuts in your mouth and your membrane and your tongue, if there's any point of entry that's open in your mouth, if ejaculate leaves that penis into your mouth, that could be a possible route of exposure. The last I checked, there were no verifiable known instances of someone becoming infected through oral sex, but the rule of thumb is it's a possible point of entry. And all people who are HIV positive know this because their counselors, doctors, and social workers tell them this. You should disclose this to your partner and give your partner the opportunity to decide do they want to expose themselves. And you should use a condom. I know people don't want to use condoms with oral sex, but you're supposed to use a condom. When you know that you're positive, or a dental dam for women, unless that person wants to take a chance. Other things that could help you. Well, let me go back to my friend and I'll talk about other stuff. So, she was a little bit concerned. So we sat there and I went online and we looked up all the different clinics that were around and the laboratories that could give that test for her. And she made an appointment. Here's this. The test is expensive. It's like $364. You're going to pay to get those fast results. But they're accurate. They're just as accurate as the Aura Quick Swab test that people take in the local clinics. So she signed up, paid with her credit card, and then I just spent another hour just trying to calm her down, and just being positive and just telling her, look, we're gonna hope for the best. If it's not the best, there's life after infection, right? So then I told her, let's just assume you're going to be okay, because right now they have not come out and put in writing that anyone has become infected that way. Let's just say that you're okay. I said, did you consistently use condoms every time? And here's where I'm willing to hop on the plane and go kick somebody's butt. She said she believed they did every time. There may have been one time when they didn't. And I'm like, what was that? She said, oh, I was kind of drunk. We were both kind of drunk, and he apologized the next day. So I don't like this dude. I said, okay, let's talk about him. Is he on medication? She said, yes. The reason why he doesn't want her to be concerned is because he is on this medication. And on this medication, for those of you who don't know yet, through Charlie Sheen, if you take your medication consistently every day, you can become your viral levels can be undetectable, but you have to take your medication every day. You can't miss it. You can't get tired. You can't say I forgot, because just that one instance could lower your levels. And if your levels are detectable, you are better able to transmit the virus if you have unprotected sex. So I told her to try to remember the moment they did not use protection and ask him, has he been consistent with using his medication? Like at this point, he needs to go to the doctor and get a test for his antibodies. That's where I am. Like he needs to show her some paperwork that he's taking care of himself. Because people who are positive tend to not take their medication because they begin to feel better and they don't want to take the medication every day because of the side effects of the liver and kidneys and other organs. It's a very toxic medication, even though it's keeping you alive. So I said, you need to go find out, you need to find out some things now. I said, have you had any sexual relations with this man once you found out? And she said, no, she hadn't been able to. It's been a couple of days. I said, okay, good. I said, don't right now because he's been playing fast and loose with your life. And this is not about love or liking. This is about honesty. And at this point, put him on ice for a moment. Just stop everything until you find out what your status is. Then she said that her man asked her, told her that she would be okay, that they could get married because there is a medication out now called Truvada, aka PrEP, that she could take that would protect her from the virus. For instance, the way it's supposed to work theoretically is that you're supposed to be able to take this one pill a day. And this pill allows you it gives you like a 96% protection rate. Don't quote me on that percentage. About 96% protection rate against acquiring HIV if the person that you're having sex with is positive. It minimizes your chances of acquiring it. Gives you an immunity. It's more effective if the person who's positive is also taking their medication to keep their levels at, at undetectable levels. So the person who's positive takes their medication to stay undetectable. The person who's negative takes his medication to protect themselves in case some of the virus slips through from the other person, right? Helps you fight it and kill it in your body. And it's just a very basic way to put it. I'll put out another video to talk about what it does. Here's the thing with PrEP. It was tested primarily in gay white males. So the medication is kind of prejudicial towards gay white men and towards men, period. And it works very well in white men. Very, very well. If they take it consistently. Doesn't work so well in women. Tests came out a year ago. Studies came out and said that the treatment protocol for men did not work at all in women. There was like an 11% protection rate. And when it first came out, they were telling people, I'm not butchering this. I'll put out another video to go into more explicit details. But when PrEP first came out, they were telling people, okay, so in order to protect yourself against potential exposure, you could take 2 pills before exposure, like 4 days before. Take 2 pills a day before exposure, and then take 2 pills a day of exposure, and then take 2 pills a day 4 days after exposure. And that was all you needed during that window to protect your body from exposure. So basically, if you're having sex every day, you're just taking a pill or 2 every day, right? It worked in men. Didn't work so well in women. They're telling women now they must take PrEP for at least 30 days prior to exposure and continue taking it. Like it has to be an everyday pill. So here is one of the side effects. It's very toxic to the kidneys. Very, very toxic to other organs. We don't know the side effects in terms of birth defects for women. If they were to get pregnant, we don't know if it causes cancers. We don't know any of those things yet. We just know that it works very well in men. So the more common protocol that two people are supposed to engage in when one is negative and the other one is positive. My screen popped up. When one is my camera on? Oh yeah. So the more common protocol is the person who's positive is supposed to take his medication or take her medication to keep their levels low, and you are supposed to use two condoms that's right, two condoms to engage in sex. That's what we used to tell people. So I haven't been in the STD counselor field for a while, but I am thinking about jumping back in because there's so much misinformation out there, and I'm also just interested in knowing for myself. But that's what's supposed to happen. So it sounds like my friend fell in love. This person didn't tell her the whole truth. Now he has to tell her the truth because they're supposed to be getting married, and because he's in such a hurry to have this to have this sexual relationship with my friend, or to continue it rather in marriage, he is not exactly giving her all the information, either willfully or through ignorance. But I was I'm very concerned, very, very concerned. And that translates to, what I have to say for everyone else. But stay tuned for the second video to hear what that is.